Hi, I'm Zevy Hamburger. I'm an anesthesiologist at Mount Sinai. I recovered from coronavirus about 4 or 5 weeks ago, and I've been working at Mount Sinai on the front lines, treating patients and trying to support our staff as we fight the pandemic. Right now, I'm on my way to donate plasma right before I go back into work to continue the fight. So I'm here in the New York Blood Center. I'm donating convalescent plasma. So what that means is that this machine is taking blood out of my arm, taking the plasma, which is the fluid component of the blood, out, and then replacing and giving me back my red blood cells and my platelets and other components of blood. So the way this works is by separating the components, they can harvest just the plasma component, which you can see up here, which is hopefully rich in antibodies. This is something called passive immunity. So if we give this plasma to someone who is acutely infected with coronavirus, the antibodies that are in the plasma from me can hopefully start attacking the virus while the person themselves start mounting their own immune response, their own antibody response. I was really, I think, one of the first people in our hospital to get the virus, at least in my department, to get the virus. I likely caught it from the outside, from the community. It's the kind of thing where a week before you're thinking, hey, it's never going to happen to me. I know how to wear my mask, I know how to wear N95, I know how to don and doff the protective equipment. And in fact, I was one of the people who was showing other people how to do it. And then I started getting a cough on this Friday. I ended up going home, putting a mask on, going home right away because the instructions were anyone get any cough, any symptoms, it's time to leave. I got fever that night, and my wife also started getting fevers, chills, some mild body aches. We got some GI symptoms. Lost our sense of smell, sense of taste, and over the next couple of days, we realized after speaking to some of the infectious disease docs at Sinai that likely we had coronavirus. Ended up getting tested in New Jersey a couple of days later, and both turned positive. So I'm headed right now to assist with an intubation. That means putting a breathing tube in someone who's getting sicker and sicker and having difficulty breathing on their own. This is the procedure that is one of the scarier procedures in the coronavirus era because this is when the virus can be aerosolized. So we're all ready to go. Jay, our respiratory therapist, is actually bringing in one of our ventilators so we can get prepared and everything set up before we actually do the procedure. So, sir, we bring in all of our equipment. Here's Charlie again with all of our equipment together, ready to go. So again, we can minimize the amount of time we actually have to open and close this door. So this is one of our ICU teams. It's run by Koichi, one of our anesthesiologists. Say hello, everyone. Working hard, taking care of the COVID patients. So Matt and I are on our way now to an ICU to help back up some of our ENTs manage a very difficult airway situation. So it's a whole team here trying to help and figure out what's going on. Hey, I'm here in one of our ICUs. I'm joined with Shinobu, one of our cardiothoracic surgeons. We're actually working together to manage a difficult airway situation. That means when there's difficulty putting breathing tubes in, or tracheostomies, which are breathing tubes in the neck instead of through the mouth, working together as a team to try and get the best outcome for our patient. Obviously, all critical care is a team sport, but especially now more than ever is a lot of communication that's needed and really planning for all of our patients. So I'm running to another intubation. This is my fifth of the day, actually. It's just about 2:30 in the afternoon. I joined the rapid response team originally because I was hoping, since I had the virus myself, I'd have some modicum of immunity. And since intubation is a higher risk procedure and it's something that as anesthesiologists is really part of our specialty, I was hoping that if I could kind of get in the way, we can prevent some transmission to some of the other staff members and colleagues. I've been intubating patients working on units for about 4 weeks now, and luckily I have not got reinfected. I have no new symptoms. I've swabbed negative. So again, just hopeful that there's some sort of immunity that we can develop to protect our staff, but also so we can take good care of patients without this fear. So one of the biggest take-home points I've learned from this pandemic, from this crisis, is our team is made up of nurses, of respiratory therapists, of ICU doctors, emergency room doctors, anesthesiologists, nurse anesthetists, everyone. Even though we all come from different areas